everyone, it's Lori with Med Made Easy. I want to talk about the appendix today. So let's get to know the appendix with some quick facts. First of all, where is it? It's located in the right lower quadrant of the abdomen, and it's basically where the small intestines and the large intestines meet. It also projects off the cecum, which is the beginning part of the large intestines. How big is it? It's a thin tube that's approximately, I'd say, 4 inches long. Roughly, if you take your index finger, it's about that size. Of course, your index finger is probably a little smaller than 4 inches, but it kind of gives you a rough idea of what the size is. What does it do? This is still questionable, but some research actually suggests that this may be where the good gut bacteria kind of hangs out, where it safely hangs out, so then if the body needs it at a later time, that it can get it from there. Another interesting fact is it's actually a vestigial structure. In other words, it probably had more of a function in our ancestors, and that evolution has actually caused it to lose some of its original function. And you see this quote here. I like this quote. I was looking through some different studies. I think the gist of this quote is basically saying that the appendix once had a bigger part of the digestive function than it currently does. Currently, there's not a lot of research out there to support any significant complications of not having an appendix, and most people, if they have to get their appendix taken out, if they have an appendectomy, it doesn't really affect the rest of the body, at least not right now that we know of. They don't really have any kind of symptoms related to this. Well, that's the quick facts. Let's go ahead and get into a little bit more personal information about the appendix, appendicitis, and appendectomy. I thought I'd go ahead and share my experience with my appendicitis and appendectomy as a healthcare provider, being on the other side. I also want to give some tips about some things that it's important for all healthcare providers to know. One morning in November 2015, I woke up with some severe abdominal pain that was not letting up. It was getting worse, and I knew myself. I knew that something wasn't right. Even though I had a history of chronic abdominal pain for different reasons, this was just different. And it was just like, it felt like something was like just stuck. It almost felt like how you would think of maybe like a bowel obstruction. That's the way it felt, and I just actively vomited. And I knew that was strange. I knew that was very strange. Something didn't seem right. Pretty bad. The pain was literally 10 out of 10. It was not something, it was just different for me. And so I knew it wasn't right. I knew myself. Something didn't feel right. Abdominal pain is a serious thing. Obviously, it's something that there's so many different things. It's where your organs are, and there's so many different things that can be going wrong when you have abdominal pain. There's some, believe it or not, kind of left, remember, middle abdomen, so it's very strange to be on that side, because usually your appendix, when you're having appendicitis, it's going to be right lower side, and sometimes it can go from the periumbilical area and then move to the right side. So for me, it started on the left side, so kind of atypical of what normally appendicitis starts off with. And I believe I had a low-grade fever. It was like, this isn't right. I'm going to the hospital. And I've literally been to the hospital, ER, I think maybe twice in my life, I think. So I just knew it was something that was not going to resolve on its own. It did take a while to get me back into an ER room, I think in the beginning, because I told them things about like my celiac disease and IBS, that they thought that it was just chronic abdominal pain. One of the first things that I remember getting is some kind of antiemetic. I believe it was Zofran, and that did help significantly with the nausea. And then the pain was just ridiculous. And I got some pain medication, and I know that they only gave me a very small dose. I know that they're very careful in the ER. You're always worried about drug seekers and things like that. Well, I don't even go to the hospital ever. So that was just not me at all. So, but anyways, so then I was in a lot of pain. They gave me, it was fentanyl that they gave me. Another little tip for healthcare providers, drug-seeking behavior. It's very difficult sometimes to tell, but one of the red flags a lot of times that will alert you for drug-seeking behaviors is when an individual requests specific amounts and decreased intervals of it. So in other words, they're wanting it every hour. You know, these patients, they do have real pain a lot of times, so sometimes it can be difficult to differentiate, but just to be aware of some red flags. Labs had been done and it did show that my WBC count was high, and I think that was the reason why they wanted to go ahead and do the CT of the abdomen. It seemed like it took a long time to get the CT. I don't even remember from door. I think in the waiting room I waited probably 45 minutes or something like that. It took quite a long time for me to get even back. After when I get to the CT, which the CT, if you've ever had a CT before, nothing to be scared about. It's open, and I'll see if I can make a little picture up here. It's open, and they just scan you under it, and it's not like a lot of people get scared with it. It's not the same thing as an MRI. Different. MRI is the claustrophobicness that you go through. So anyways, so then did the CT. So then the results came back and they're like, oh, you have appendicitis, so you're gonna have surgery. My appendix hadn't ruptured, but went and had surgery, and then that was that. I stayed at the hospital for one night. My blood pressure did get into the 70s. The surgeon wasn't that worried because he said I was asymptomatic, in other words, no symptoms. I did have fluids going right afterwards. I don't remember being hungry. I know my stomach was definitely sore. And then the surgery that I had was a laparoscopic surgery, and what that basically means is they went through tiny incisions that they make in your abdomen. I think I had a total of 3, I believe. I didn't have any complications from my surgery, but it's extremely important to know that if you're a nurse and you're getting the discharge paperwork ready, you want to make sure that you teach the patient of signs and symptoms to look for if they potentially, obviously need to return, or if there's a potential infection. Especially at the surgical site, you worry about, the patient getting septic. So you want to tell them things like watch for fevers, chills, confusion, if there's increased redness around the surgical site, or if they're starting to notice purulent, or in other words like green or yellow pus-looking drainage coming from the site, or severe increased pain unproportionate to what you'd think that the patient would be having. Pain is normal, but just a significant increase is definitely not necessarily normal. And I was sent home. I don't even know if I was sent home on any kind of narcotics at all. Honestly, I don't think I was. But I was very tender for the next couple weeks, and it just felt like you had surgery on your stomach. And so that's exactly what it felt like. And you're not supposed to lift heavy things after surgery, and so I had to be very careful about what I was doing and exercise and different things like that. The other thing that I wanted to mention is that, and this may surprise some people, but you actually lose hair a lot of times after you have surgeries. I know I did. Any surgery that I've ever had, this has happened. And it's basically because a phenomenon called Telogen effluvium. Hopefully I'm saying that correctly. We don't say that word too often, that combination of words too often. So basically what happens is in times of any kind of stress or, like such as surgeries, the body basically diverts its attention to that area that's needing to be healed. And basically the growth phase is kind of stopped, and you have basically everything goes into the rest phase. The literature that I have found says that typically it does happen, the hair loss happens typically between 2 to 3 months after those big stressors or things like surgeries, and that's about typically the time that it happened for me. The other thing is some people go through constipation if you're on narcotics, and so taking a stool softener is a great idea. I do not believe I was on narcotics, so I did not have an issue with this, but that's just something to keep in mind. Thank you guys so much for watching. I can't tell you how much that means to us. You are the reason why we are motivated to do what we do. We love helping people, so if there's anything that you want us to do a video on, please comment below. Also, please subscribe and hit the notification bell. Give this video a thumbs up if you want us to make more videos like these, or if you have other ideas, as I mentioned. And then also check out our other social media sites. We're also on Facebook. We have a Facebook page, we have a Pinterest account, and also Instagram as well. Have a good day, guys. Until next time.